So before I administer the medication to the client, to the patient, I'm gonna do first my preliminary review of the MAR. So now I have the MAR here. Patient is Kate Knudsen. Diagnosis are the following: Parkinson's disease, Lewy body dementia, OA on the knees and hips, and patient is allergic to sulfonamides, penicillin, hydromorphone, and morphine derivatives. For the medication, it's polysporin Heal Fast formula, 30 grams, to be applied to the abrasion on the right elbow until the skin is intact, and medication to be applied twice a day at 800 hour and 2000 hour. And I see that there's only one page on the medication record, and I don't see any discontinued medications, and there's no medications not previously administered. So now that I know the medication that needs to be administered to the patient, I'm gonna do my medication research. So, yeah. So here it is. Brand name, it's polysporin double antibiotic. For the generic name, it's bacitracin and polymyxin B. For the use, it's for the treatment of skin infections such as wounds, burn, boils, and acne. Action is it works by slowing or stopping the growth of bacteria, and its route topical to be applied to the affected area. Side effects, allergic reactions like rash, hives, itching, redness, swelling, blistering or peeling of the skin, wheezing, and tightness of chest. For the nursing consideration, it should be used only for skin, never taken by mouth, and assess for any presence of allergy to bacitracin, polymyxin B, or other part of polysporin, and to make sure that to clean the affected part before and after use, and make sure to dry well. So now that I've done my medication research, I'm gonna go and proceed to gathering appropriate supplies for the administration of the medication. Okay, so now I've gathered all the materials that I'll be needing for the medication administration. I have here the ointment with the label on it, and I have here the supply needed to clean the area, and the cotton tip applicator, the garbage bag, and I have the gloves on my pocket. And now that I'm sure that all my supplies are complete, I'm gonna proceed for on my first check. So, okay, I have the MAR here and the ointment. So patient, Keith Knudsen. Okay, Keith Knudsen. Medication, polysporin Heal Fast formula. Polysporin Heal Fast formula, 30 grams. 30 grams. And to be applied to abrasion on the right elbow until the skin is intact. Apply to abrasion right elbow until the skin is intact, and to be applied twice a day at 800 hour and 2000 hour. To be applied twice a day, 800 hour and 2000 hour. So now that's my first check. Now I'm gonna do my second check. So patient, Keith Knudsen. Keith Knudsen. Medication, polysporin Heal Fast formula. Polysporin Heal Fast formula, 30 grams. 30 grams, to be applied to abrasion on the right elbow until the skin is intact. To be applied to the abrasion on the right elbow until the skin is intact. To be applied twice a day, 800 hour and 2000 hour. To be applied twice a day, 800 hour and 2000 hour. And for the second check, I'm gonna check the expiration date on the ointment. So, okay, the expiration date is February 2021. Okay, so now I've done my first two check, and I'm sure that I've gathered all the materials. I'm gonna lock my medication cart and proceed to the client's room. Okay, so now I'm at my client's bedside. Before I administer the medication, I'll make sure that I perform my two identifier checks. And hi, how are you? Okay, good, good. Okay, so just gonna wash my hands. And this is my mark. Okay, so can you tell me your last name, please? Okay, Nansen. Okay, so can I just take a look on your IV bracelet? Okay, so Nansen, birth date February 18, 1948. Okay, February 18, 1948. Okay, so now I perform my two identifier checks. I'm gonna explain to the patient about the medication. So Kate, have you taken this before? No? Okay, so here it is. It's an ointment, and it's called polysporin, or double antibiotic, and it'll be used to treat the abrasion on your right elbow, and it works by slowing or stopping the growth of bacteria, and we will apply it on your skin on that affected area. And for the side effects, if you feel any of this or observe or see on your right elbow or the surrounding skin, just let me know, okay? I'm gonna leave the call bell within your reach and call me. Okay, so observe for any allergic reactions like rash, hives, if you feel any itching, see redness or swelling, blistering or peeling on the skin, or if you feel any tightness of the chest, okay? Okay, thank you. So now I've explained the procedure to the client. I'm gonna proceed on my third check. Okay, so patient, Kate Knudsen, medication, polysporin Heal Fast formula. Okay, polysporin Heal Fast formula, 30 grams. Okay, 30 grams. Apply to abrasion, right elbow, until the skin is intact. Apply to abrasion, right elbow, until the skin is intact. Okay, to be applied twice a day, 800 hour and 2000 hour. To be applied twice a day, 800 hour and 2000 hour. Okay, so now I've done my third check. Before I apply the medication, make sure that I position the client comfortably. Okay, so Kate, I'm just gonna pull your sleeve up, okay? Okay, so just gonna expose the elbow and just gonna put a pillow under your arm so that you are comfortable. Okay? Okay. So my hands, and just gonna put on my gloves. Okay, Keith, as I apply the medication on your right elbow, you're gonna feel a little bit cold, and make sure that you don't touch it or let it be covered with your clothing or with your blanket, okay? Okay, so first I'm just gonna clean it. Just gonna clean your elbow. Okay, and then let it dry. Then okay, so now that I apply the medication on the patient, I'm gonna proceed to documentation. And before I go for the documentation, make sure that the client is safe and comfortable. Both rails are up, call bell is within his reach, and bed brakes are on, and put the bed on its lowest position. Okay, so this is my documentation. I put in my initial at 8:00 under the 16th day of April, And then I put my signature on the signature record, date, my name, my status, my signature, and my initial, same as the one that I put in on the medication record. And then after I documented, I'm gonna go and evaluate the effectiveness of the medication and to see the client's response and further document as required.